X-ray mammography. Is it worthwhile? This presentation is by Daniela, Andra, Jeanette, and Charles. In this presentation, there are 7 points that will be answered. These include: what is mammography? What are the common uses of this procedure? What is breast cancer? How does breast cancer develop? How does the application of X-ray mammography address a specific clinical problem? Investigate X-ray mammography and its emerging imaging techniques along with its likely extent of application, and address the issues arising in the management and practice of imaging technology.
What is mammography? Mammography is an X-ray imaging technique where it images breasts to detect cancer early. It uses low-dose X-ray system to view the internals of the breast. The mammogram is used to help detect breast cancer earlier and to diagnose the disease. Recent advances in mammography include digital mammography, computer-aided detection, and breast tomosynthesis. Digital mammography is a system where the X-ray form is replaced by electronics that converts X-ray into mammographic picture of the breast. Computer-aided detection system search digitalized mammographic imaging for abnormal area of density, mass, or calcification that may indicate the presence of cancer. Breast tomosynthesis is an advanced form of breast imaging where multiple imaging of the breast from different angles are captured and synthesized into a three-dimensional imaging set. What are common uses of the procedure? Mammograms are used to detect early breast cancer in women experiencing no symptoms, and also to detect the diagnosed breast disease in women experiencing symptoms. These symptoms may include lumps, pain, and skin dimpling.
What is breast cancer? Breast cancer is cancer that develops in breast tissue. The structure of breasts consists of lobules and ducts surrounded by fatty and connective tissue. Surrounding the breasts are lymph nodes, which are part of the lymphatic system that help to protect the body from infection. How does breast cancer develop? Breast cancer can start in the ducts or lobules of the breast. There are 2 types of breast cancer: non-invasive and invasive. Non-invasive breast cancer is where cancer cells stay in the ducts and lobules of the breast, and invasive breast cancer is when the cancer cells spread to the surrounding tissue. The site where the cancer starts is called the primary cancer. In some situations, the cancer cells can spread to the bloodstream, lymphatic system, or other parts of the body, such as bones. This spreading is called metastatic breast cancer. How does the application of X-ray mammography address a specific clinical problem?
Breast cancer, one of the most frequently diagnosed cancer, which accounts for 25.5% of all cancer-related deaths in women's population worldwide, followed by colorectal, 9.2%, lung, 8.7%, cervix, 7.9%, and stomach cancer, 4.8%. According to statistic data collected by World Cancer Research Fund International, in the year 2012 alone, there were estimated that 14.1 million cancer cases reported. 6.7 million of that occur among women. This number is expected to rise to a whopping 24 million cases annually by 2035.
Investigate X-ray mammography and its emerging imaging techniques along with its likely extent of application.
Up to these days, no one knows what exactly is causing the tumorous tissue growth in the breast, but what differentiates the level of the risk factor in each individual are things such as lifestyle habits, especially family history of genetically inherited breast cancer. In the case of the genetic inheritance in family mutation to the gene BRCA1 to BRCA2 get passed down to offspring. Carrier of BRCA1 and BRCA2 mutation have an 85% chance of breast cancer occurrence by the age of 17 years old. Mammography is one type of medical imaging which uses X-ray to capture breast tissue with suspect tumor growth. Two types of mammogram, screening and diagnostic. Screening mammogram aim to examine patients that shows no early symptoms, whereas diagnostic mammogram aim to examine and detect for breast cancer after symptoms have been detected in patients.
Address the issues arising in the management and practice of imaging technology.
Mammography is the best tool for screening and diagnosing breast cancer, but this imaging technology also has issues with the management and practice. Many radiology practices are converting from film mammography to digital mammography. The first clinical digital mammography system was approved in 2000, but since the execution of this technology has not been thriving as steady due to high costs and a lack of data supporting improved diagnostic. Compare film and digital mammography has shown insignificant difference between those two technologies. Digital mammography has not performed as well as film mammography when area under the receiver operate curve or cancer detection rate was measured. There have been larger studies on digital and film mammography, where one being the digital mammography imaging screen trial. This study was funded by the National Cancer Institute, where the American College of the Radiology Imaging Network conducted the study. This study was conducted on 49,528 women, where they underwent both digital and film mammography. This study shows that for the whole population of women, there were no significant differences in diagnostic accuracy between digital and film. Specificity and positive predictive value 1 measurements in the study shows no differences between film and digital mammography.
To conclude,
mammography is worthwhile, even though there are many issues and implications of the imaging technique. There are also many benefits with mammography, such as screening and diagnosing breast cancer at early age. This tool is useful to prevent the growth of the breast cancer in patients, and also a great technique in detecting and treating breast cancer.